My name is Dr. Diana Canto-Sims. I'm an optometrist and practice owner of Buena Vista Optical in Chicago. Today, I'm sitting down with Dr. Kevin Kovach for a conversation that I believe every ophthalmologist needs to hear, because a strong OD-MD collaboration and successful partnership doesn't just happen, it's built intentionally, one relationship and one referral at a time. Dr. Kovach is going to share what it really takes to be the kind of ophthalmologist that optometrists truly trust, return to, and refer to with confidence. So if you want to be that partner for the OD in your community, this conversation is for you. So let's get into it. I'm joined today by Dr. Kevin Kovach, a board-certified comprehensive ophthalmologist with more than 30 years of clinical and surgical experience serving patients throughout Chicago and the greater Chicagoland area. As the founder and medical director of Kovach Eye Institute and owner of the Ophthalmology Surgery Center of Illinois, Dr. Kovach is recognized as a leader in advanced ophthalmology with expertise in cataract, glaucoma, refractive surgery, and the comprehensive management of complex eye conditions. He was also the first surgeon in Illinois to perform SMILE LASIK and EVO ICL procedures, bringing some of the most advanced vision correction technologies to patients across our state. Dr. Kovach, thank you so much for being here.
Thank you for this communication.
So let's start with the big picture. Most ophthalmologists in practice depend on OD relationships, but not all of them invest in building them. What are three important things an ophthalmologist can do to become the kind of partner that ODs trust, respect, and constantly refer their patients to?
Thank you. I think it's very important to obviously have the best technology to deliver the best results for patients in general. It's important to educate optometrists or ophthalmologists that we work with as to what technology is out there as it becomes, where is it useful in patients' care, and continually communicate these advances in technology and how they should be integrated into our practices. And it's important to communicate effectively with each and every optometrist and get to know the comfort level of the care provider, optometrist or ophthalmologist that we are working with, so that we have seamless care and the highest level of care seamlessly throughout the relationship of transferring patients back and forth between different doctors' offices.
Absolutely. So I know you've been doing this a long time. How do you personally approach building relationships with ODs in your area? And what has made those relationships last? Give us your secret sauce.
Oh, my secret sauce. Well, number one, I have an excellent team of liaisons and educational coordinators internally and externally that help me communicate constantly with all the doctors that we are working with. They are always available for communication between offices. I've surrounded myself with an excellent, well-educated team that knows how to provide these type of communications back and forth and provide updates in patients' care on a daily basis, live action wise. We have excellent technology with our electronic health systems and portal systems to facilitate these communications. And I try to know every single doctor that would refer in and understand their comfort level and what type of experience they provide to their patients, so that I understand what the patient's expectations are coming into our office, so that we can deliver same highest level of care that their patients are used to coming from the referral office.
Right. And those relationships last because you have that thorough follow through and the excellent surgery that you do, right? That the patient, if the patient is happy, the OD is happy, and that is when the relationships really truly last. What does it look like when an ophthalmologist truly protects and honors the referring OD relationship with the patient? I mention this because some ODs fear that the patient that they referred will never come back. So, what does it look like when an ophthalmologist actively works to protect that relationship?
We always are communicating when the patient has been seen, why they were seen, what was discussed in the encounter, uh, depending on what the referral was for. There are daily communications as far as the assessment and plan being communicated back to the referring doctor's offices. For those who are co-managing, we provide immediate communications through our portal or other secure HIPAA compliant fax or email communication systems to communicate that care, when it was done, what was done, and why it was done. So that communication is key, and utilizing technology that is available is very important in all of our offices to efficiently deliver those communications.
I think that's really important. We talk so much about communication and the systems that you use in place. And I called it your secret sauce because I remember in the past we didn't have communication that was so thorough with our referring OD. And I don't know if you can share a story or why you decided, no, this communication has to be thorough, it has to be in place, we need a system, we need to hire the right people. Was there a story that you decided is like, no, this needs to be done a different way because the way it's being done is not working, this is what I'm going to start implementing?
Well, this has developed over my 30-year career.
Which is
Knowledge
why
has
we
continued to.
aspire so much.
So we've tried hard. I mean, it's important for me, for us to have relationships and understand each other. That trust factor is key. Each doctor needs to be comfortable that they can communicate either through our staff or directly with us. And every doctor that I work with has my personal phone number, but I'm not always available if I'm in the operating room to be able to answer a text or immediately answer a phone call. So we have an excellent team, as I mentioned, of liaisons and educational coordinators who help our doctors communicate our care that's being performed on referred patients. It used to be that I would just call or text an optometrist or ophthalmologist that I work with and say and communicate when care was done, what sort of surgery was done, what technology was used, what data was done. And then it developed into emails and staff members just calling the optometrist staff members. And now we have excellent higher levels of technology with our electronic health systems, our portal systems. You know, artificial intelligence will be important in evolving even better communication systems so that we're not bogged down with the time that it might take to provide the information back and forth. The whole point of technology is to make our lives easier so that we're spending more time with our patients directly as far as, you know, being with the patient and communicating and delivering the care that we need to the greatest numbers. So we need to continually evolve in the use of technology to be able to provide effective communications back and forth. And there's been some great advances almost, you know, year by year or twice a year now. There's changes in our portal systems and ability to communicate back and forth.
There's always updates, right?